Hello, I'm Chris Ruhm. I'm a professor of public policy and economics at the Batten School. Thanks for joining us today. What I'm going to talk about are what we know and also what we don't know about the effects of the current recession related to the COVID-19 virus on health and mortality. I want to emphasize at the start that what I want to do is provoke your thinking on these issues. As you'll see as we go on, almost everything is uncertain. I'll try to provide some guidance. I'll speak for a few minutes and then we'll take question and answers. And I want you to note, if you go to the bottom of your Zoom panel, there's a Q&A prompt. So if you want to ask questions, that's where you'll do that. You can type them out as we go, or you can wait until the end. So thanks very much for being here. I wanted to give you a little history about how I got into this. I've been looking at the effects of macroeconomic conditions and health and mortality for probably close to 25 years now. I started looking at this originally from work I'd done on labor displacement. And I was interested in seeing if people were laid off, did their health get better or worse? But then I kind of expanded that to think about the general state of the economy. And my assumption going into this was that when we had bad economic times, people's health would get worse. And so I was quite surprised when it turned out that I was, to at least a large degree, wrong about that assumption. What we're going to see is, in normal bad economic times, people's physical health actually improves, although their mental health probably does not. So what I'm going to do, since I'm an economist, I have to show you a couple of slides. That's just how we roll. I'm going to show you summarize some results of some of my early work. So I'm hoping you can see this. This is from a paper I wrote in 2000, actually, called "Are Recessions Good for Your Health?" And what I'm showing you here is a picture that shows you the unemployment rates. This was from roughly the 1970s through the 1990s, the data period I was using there. So we have the unemployment rate and the total mortality rate. Now there's some processing that went on here, doing things like detrending the mortality rates and putting these on the same scale. But what you notice here is there's almost a mirror image. So when unemployment was high, mortality was low, and vice versa. These are just correlations. They are certainly not definitive answers, but that led me to do a lot of work on this to try to come up with much better estimates. And so I have to figure out how to get my slide to go forward here. This is interesting. A little snafu here. This is what happens. Okay. Let's see what we can do. Okay, I'm going to try to come back to let you see this picture if I can. I'm having some technical difficulties here, so I'm going to leave that. I'm actually going to talk you through what happens because I seem to be having some technical difficulties. So what I was going to show you was the effect of a 1 percentage point increase in the unemployment rate on a variety of outcomes. If we looked at all deaths, when the unemployment rate went up by 1 percentage point, deaths went down by about 0.5 percentage point. That was true for heart disease deaths as well. And there was a very big reduction in deaths due to vehicle and other accidents. On the other hand, suicide deaths went up. So one interpretation of this is that in bad economic times, in recessions, physical health improves while mental health does not. Now, it turns out, and I was going to show you another slide to this effect, that effect has weakened somewhat over time, but not completely disappeared. So there's good reason to believe that that when the economy improves, health gets worse. When it gets worse, when the economy gets worse, health gets better. I'm going to try to share one more time because I want to show you this slide if I can get it to show up. And I think it is not. Is it showing up? It is not showing up here. I am having
Yes.
It
We're
is
seeing
showing up. You can see the slide.
what you may be able to do is move to this unshare. Well, you're sharing now, but unshare, move to the slide. Or I think now we can see the whole thing if you go through your slides.
Okay, well, I'm hoping you can see the slide I have up, which is showing you the current situation with flu and COVID deaths. So annual flu deaths are in the order of 12 to 61,000 a year. This is in the US. And sometimes you've heard people discuss how maybe the COVID epidemic isn't any worse than a flu year. That is unlikely to be true. But here's the situation. I've written out a hypothetical best case scenario with the optimal policy response. And what I base this on is what we've seen in South Korea. So if the US had done everything South Korea has done, and then we adjust for things like differences in population size, we might have seen deaths on the order of 2,500 in the US. We're obviously far above that already. We're at about 13,000 today. And the question is, where are we going? The answer is we don't really know. What I've written out as a current best case scenario that I put in quotes is around 50,000 deaths, possibly lower than that amount. What we really don't know is how deaths and cases are increasing. They are still increasing. We're hoping we're seeing a slowed increase. In the worst case scenario, which will not occur, in the do nothing scenario, we might have seen on the order of up to over 2 million deaths. Now, to place that in context for you, we have approximately 2.8 million deaths in the US in a year. So if we had seen 2 million deaths from the COVID virus, that would have dominated everything else. We're not going to see that. Where we're going to be between that maybe 50,000 number and some higher number is really quite important in terms of telling how severe this becomes. And what's interesting here is we know that in certain areas we're likely to see reductions in death rates. So for example, in bad economic times, and certainly that's true today, we see a dramatic reduction in driving. We have fewer traffic fatalities. Air pollution goes down dramatically, and so we have fewer deaths related to air pollution. So these could be things like respiratory deaths, but also cardiovascular deaths and so forth. So we have a variety of components where we're likely to see reductions in deaths. What's new, and maybe this is obvious, but what's new here is we have a recession that is caused by a health shock, by the coronavirus shock. And so that's what the table I showed you earlier, that range is going to determine what we see as the ultimate change in deaths and in health more generally. The other thing I'm going to note before I throw this open to Q&A is that some of the things that happen in a typical recession may not happen now. So for example, one thing we know is exercise, leisure time exercise often increases when people have, when the economy deteriorates, people have more time available. That's going to be harder now because, for example, gyms are closing, many people are operating in stay-at-home orders and so forth. We've also talked about how suicides and mental health problems increase in bad economic times. That could easily be worse today. One of the reasons being it's harder for people to engage in the social supports they normally have because we're all more socially isolated. So we have an unknown situation. There's also the question of what the next step is. So some have discussed the trade-off. Do we have a trade-off between health and the economy? And I'm happy to elaborate on this in Q&A if we wish to. But the answer right now is almost certainly no. If we were to end this period where people are staying at home, the number of deaths would dramatically increase, so towards those higher numbers. We'd also see other disruptions. People would be absent from work because they're sick. They'd be afraid to engage in market activities. So there really is not a trade-off at present. What's going to get interesting and quite tricky is as we move past this immediate phase, what comes next? How do we gradually restart the economy? What are the procedures for doing so? We don't know the answers to all those questions. We do know some of the pieces. We're going to need to have sufficient personal protective equipment so that people can work safely. We're going to need to have sufficient hospital resources so that people who do get sick can get treatment. We're going to need to see periods where the infection rate is falling. And so those are questions for the future, and we'll see where we go. So why don't I, with that introduction, open this up to some more general questions. Thank you. Okay, so I have a question. This is from Jesse Burkett. Do you have any thoughts about how we as individuals can protect our health during the coronavirus recession? You know, that's a really good question. I think most of the answer is to do what we're being told to do, which is, most importantly, stay away as much as you can from the risk of infection. So that means staying in your house. It means when you leave the house, where you have to leave the house, wear your protective equipment, your masks, your gloves, and so forth. Obviously, washing hands. I mean, all of that. So I think the kinds of things that we're hearing about, I mean, those are the things we need to do in the short run. Thank you. So I have a question from Brian Williams. Do we have lessons we can learn regarding the disparate impact of COVID-19 is having on African Americans in particular? What might be some implications for leadership and public policy? Yeah, you know, that's a really good question. We are seeing evidence that African Americans are being hit harder by this. I don't think we know sufficiently what the causes are. Some of that is probably related to living situations, you know, living in more dense populations. So that's clearly a risk factor. Some may be due to pre-existing health conditions or others. I mean, I think the general lesson I would say is we need to be looking at vulnerable groups and what we can do more generally to protect their health. That extends beyond the current situation. But yeah, I mean, we are seeing that. I think as time progresses, we're going to have a better sense on causes of a lot of these. Okay, so this is a question from Kirsten Gelsdorf. It seems like there's a much greater emphasis on mental health in the mainstream media and blogs. Can you elaborate a little on the trend and support for mental health in times of economic downturn? So, you know, I think mental health has been generally underemphasized traditionally relative to physical health, partly because it's much harder to measure. You know, we don't have good population-wide measures of mental health, or very limited ones. I think it's right, we are seeing more discussion of it now in this case because one, I think it's getting more attention generally, and two, because it does seem to be at greater risk. I think you know, the issue of how we provide those supports is an important one in any economic downturn. It's even more important in this one where, you know, some of the normal social supports aren't there. So, you know, for a lot of people, it's meeting with their friends, it's going to their churches, those kinds of activities. That's where they support their mental health. That's clearly a much more difficult issue for many people in this time, and something to be concerned about. I think there is an attempt, certainly, for example, at UVA, there's being an attempt to respond to the mental health issues that some of our students and employees might have, but that's a difficult one. Okay, I've got a question here from Macy Brandon. Your talk is focused on deaths, but what do we know about the effects of recessions on health problems other than deaths? Yeah, you know, that's a really good question. One of the reasons we focus on deaths is they're much easier to measure. They tend to be more cleanly measured. To the extent we have evidence that it seems like other kinds of physical health follow deaths. So for example, we do have some evidence looking at things like back problems, that back problems which might be related to physical labor probably decline typically in recession periods. So we also know a lot more about inputs into health. So about things like exercise and drinking and to some extent eating healthily. So we see more on some of the inputs. And for the most part, in typical bad economic times, those improve. It is unclear whether that's going to be the case here. So for example, drinking does fall in a typical recession. Whether that's true this time around, I think we just don't know. So yeah, again, there's an awful lot here that we don't know. Okay, I've got a question. I've heard that health often suffers when people become unemployed. How is this consistent with the positive effects of recessions on physical health that you highlight? Yeah, that's a really good question. So it is true that we have a lot of evidence an individual who becomes unemployed tends to have more health problems. They also die sooner. How is that consistent with these broader effects that I've been referring to? So when I've mentioned using the unemployment rate, that's really a proxy for the macroeconomy. It's not looking at the effect of an individual becoming unemployed. So it's quite plausible that an individual who becomes unemployed becomes less healthy even while overall population health improves. What is very unclear again is what is going to occur this time around. So one of the things we're seeing are record-breaking increases in unemployment, and so that could easily increase the negative effects we've talked about of people becoming unemployed. On the other hand, we are seeing, for example, dramatic increases in financial support for the unemployed. So the unemployment insurance system has been made considerably more generous, both in the amount of money people will receive and in who's eligible for benefits. And so it's possible, it's hopeful that this will offset those effects, but we don't know. Another factor that is potentially relevant is there's often a stigma to becoming unemployed, or people feel that there's a stigma, and that could have that could lead to other negative health effects. It may hopefully be true that it'll be less stigmatizing in this situation where we have so many more people becoming unemployed, clearly for reasons that are no fault of their own. We have some evidence from other sources that when that's the case, when people become unemployed along with many others, for example, in a plant closing, there's less stigma attached to it. So we'll see, but yeah, that would be my answer to that. Okay, I've got a question. Yeah, the question is, this is from Olivia McLean, would you mind elaborating on why there is no trade-off between health and deaths caused by economic insecurities? This is the most common argument I have heard regarding ending the social distancing and quarantine. So I think the question here, if I understand it, is that we know that we are in a sense driving the economy into a recession through the policies we've created. I mean, this is the first period, the first time in certainly my recollection, but I think it may be the first time in history that we are actually deliberately creating a recession, not because we want to create a recession, but because this health threat is so real. Now, at some point in the future, there probably will be a trade-off between what we do with the economy and and how we address this health situation. That is, as we start to get a handle on this virus, certainly as we start to have people who have some level of immunity or who have been infected and recovered from this, we are then going to start facing trade-offs potentially. How do we reopen the economy in a way that protects health as much as we can, but with the realization there may be a trade-off there. At the present time, if we were to immediately open the economy, we could easily get into a situation where we had hundreds of thousands or even millions of deaths. That would be such a dislocation. That would have such negative effects on the economy. It would prolong the downturn to such an extent that we would probably end up worse off, almost certainly end up worse off than doing what we're doing now. Worse off, I'm saying, in terms of the economy, in addition to the negative health effects, the millions of deaths, the hundreds of thousands or millions of deaths. There's certainly millions of people who would be infected with this virus. So yeah, although we don't have a trade-off at present, we may at future. And that's where it's going to get really tricky. That's where we're going to need really good policy. You know, how do we manage the re-engagement in a way that is both has minimally negative effects on health and leads to the biggest gains in the economy. You know, here I do think there are important lessons to be learned from what some other countries are doing. I mean, although we haven't really seen that kind of re-engagement in the economy very frequently, we are seeing different ways that countries are protecting health of their citizenry. Thank you very much for that question. All right, I have a question from Sean Belowski. How confident are you that we will be able to understand the true health consequences of COVID-19? I've seen reports that the actual death rate might be underreported, particularly among home deaths. I also wonder how to quantify any health effects of missing routine checkups that could lead to early detection. If this is a problem, how does that impact the policy response? Yeah, I mean, Sean, that's a great question. When this crisis started to emerge, I was actually doing some tweeting about looking in a lot of detail at the statistics, trying to see what we could extract from them. And I think it turns out that's an extremely difficult exercise, more so than I would have thought when we started this. So we know in terms of the infection rates, the number of cases, we know those numbers are wrong. They're probably in almost everywhere they're too low, and probably everywhere they're too low, but in many cases they're going to be an order of magnitude too low. We saw that, I think, in Italy pretty clearly. I think we're seeing it in the US. One of the keys is how widespread is testing, who is being tested and when. It's clear at present in the US, at least in many parts of the country, doctors are telling patients, assume you have COVID-19, you have all the symptoms, but because you're not so severe at this point, and we have a shortage of tests available, we're not going to test you. We're going to we want you to assume you have it, but those cases are not being recorded. And that could be, massive numbers of cases, and it's probably geographically not uniformly distributed. So when you're making comparisons across, for example, states in the United States, they could be extremely biased. In addition, it turns out that deaths are almost certainly not being recorded accurately. So there's been recent reports in New York of a surge of deaths at home that are probably due to COVID-19 that we're not attributing to that. It's almost certainly true in many parts of the countries that are recording much lower death rates, but really don't have the system set up yet to measure those, that we are not counting important deaths. That's going to make it very hard. Over time, I mean, once we're through this, I think we're going to see a lot of epidemiologists and economists, folks like me, who will be pouring through the data, and we will get a better understanding, but it's going to be slow to obtain. It's going to be incomplete. And then, for your other questions, other effects on things like missing health checkups, other kinds of preventable care, that's going to be hard. I think we will be able to, over time, get some sense on some of those, but it will be incomplete. One story I just read this morning was how doctors and hospitals are reporting a big reduction in people showing up in the emergency room for conditions where they normally would. So for things like heart attacks, it's probably true we've got people who have those kinds of conditions who are thinking it's too risky to go to the emergency room, particularly maybe when they think it's a borderline case, and there are going to be negative health effects there that we're not measuring. Okay, let's see. I'm going to try to take a couple more quickly. So Chasten Hall is asking, what are steps or timelines for reopening the economy? How do we do that without a massive resurgence in cases, assuming no vaccine will materialize anytime soon? Great question. I think that is going to be one of the hardest issues in this. I think it's where policy response is going to be absolutely critical. I think what we know is not yet. And we're going to have some indications. You know, we're seeing maybe some suggestion of cases starting to flatten or decline, but whether that's going to be continuing, we don't know. We're going to need to see that probably for at least a couple of weeks. As I mentioned, we're going to need to have testing capacity, personal protective equipment, and so forth be much more widely available than it is at present. So I don't think we're going to know the answer yet. I hope we're talking about you know, a period in a couple of months, but we'll see. Okay, let's see. Lady Lockhart Malone, what are your thoughts on the current administration's response to COVID? What are the anticipated pros and cons? How will the upcoming election be impacted, if at all? I decided in this talk I was going to stay away from giving my political opinions. Some of you may know them. What I will say is this. I think you can look at countries like South Korea, Singapore, some others, maybe to some extent Finland, for model responses, and you can evaluate for yourselves how close or far we are from those model responses. Some of them have involved ramping up things like the availability of testing and personal protective equipment, of tracking people who are infected, and I think we've had some serious deficiencies. Let me leave it at that for the moment. I'm happy to talk offline to anybody who'd like. Okay, how likely is it, do you think, that improved increased unemployment benefits will remain in place after the crisis has passed? My assumption will be there possibly could be some changes, but mostly they won't. I think once, you know, these were put in place related to a crisis period, but I would think for the most part, they won't last. I think in some cases, you know, it's true that unemployment benefits are at too low a level and for some people not sufficiently available. So some broadening of benefits would probably, in my view, be desirable, but probably not to the extent we're seeing now. I think these are appropriate increases for what's really a crisis situation. So yeah, I think that's my answer. All right, let me take one last question here. This is from Bradley Ketcher. You mentioned that deaths are more cleanly measured than other morbidities. Recently, we've heard of issues regarding the underreporting of deaths due to underlying causes being reported as COVID deaths. And there's some suspicion that other countries, for example, China, may not be accurately reporting their deaths. How will researchers deal with these misrepresentations of the data, and how can we use this information to best prepare for future pandemics and outbreaks? So, you know, yeah, I mean, I think the data are of varying quality. You know, I think we have heard of underreporting of deaths in places like China, and I suspect underreporting of cases as well. I think that's also true for the US. We certainly have underreporting of cases and almost certainly underreporting of deaths. I think, you know, better surveillance systems are one of the keys in future pandemics and outbreaks. You know, in a sense, that's one of the functions of the Centers for Disease Control and Prevention. I think historically they've done really a very good job on that. I think their ability to do that has been hampered somewhat in this situation by policy decisions that have been made. I mean, they've really been heroic in other situations, and not just in the US. For example, with Ebola, I think they had a heroic response, mostly not in the US, that made a huge difference. So one of my answers would be, we really need to recognize and support the importance of the CDC for being able to serve their functions. that will be very important going forward. I'd like to thank you all very much for joining in. I hope this has been interesting and informative.